So I want you guys to just kind of check in with your bodies and kind of see what's going on from head to toe. Just begin to get in touch with any sensations without judging them, just being mindful of them. Allow yourself to completely relax. No one needs you. You're here completely for yourself. Tuning out any noises, any thoughts. You can use your breath to exhale and release that out if it comes into your awareness. Just start to check and see if your feet are on the ground. Connecting your feet with the earth. You can imagine that there's roots coming out the bottom of your feet. Noticing with each breath you take that those roots continue to grow and expand deeper in the earth beneath you. Noticing if you have any anxiety, any tension, any tightness, that you can use the roots beneath your feet to pull that calming, grounding energy up. Feeling it come through your legs, through your thighs, to your root between your legs, into your hips. Slowly moving up the center of your body. Perhaps there's colors coming to you as you're imagining this. Noticing the sensations that are slowly going up your body as you become more and more grounded, more relaxed, completely aware and in touch with your body. Slowly moving up into your heart center. Pause here at your heart center. Visualize the color green, just like the grass. Really connecting, expanding with each breath, opening up your heart center. You pull that energy from beneath you and allow it to travel up into your body. Notice how much more calm and peaceful you become. Continuing up, traveling that air, that energy, that calmness up into your throat, into your shoulders. Feel any tension or tightness, you can shrug your shoulders, stretch them out, maybe Rotate your neck a little bit. Noticing with each breath you take, that tension, that tightness, any anxiety that you're feeling just starts to melt away. Continuing to pull that energy from beneath your feet, using your breath, traveling up now to your forehead, between your eyebrows, third eye. Perhaps a color comes to you here, and you can use that color to radiate and expand that area, opening up that energy center between your eyebrows. And as you do this, this will allow you to see things much more clearly. Again, noticing any tension or tightness that you have, whether it's in your jaw, your cheeks, perhaps even your eyes and your forehead. Use that color to expand and contract, melting it away, releasing any tension, any tightness. If any thoughts are coming into your mind, just focus back into the present, into focusing on the area between your eyebrows. You could even use the words calm and relaxed to remind you that that's all you need to do right now. As you continue to pull the energy up from the bottom of your feet through those roots that connect you to life force, you can imagine that there's a straw, and just suck all that energy from beneath you, traveling all the way up and out through the top of your head. Imagine that there's a white steam or cloud or smoke that's coming right out through the center of your head. Allowing you to fully connect from what's beneath you and what's above. Scanning your body one more time, checking to see if there's any tension, any tightness, and you can send your breath to that area and imagine that there's a nose right in that spot, exhaling it out, releasing, relaxing, and fully letting go. Pay attention to how your body's feeling in this moment. And relaxed. Feeling peaceful. Noticing any sounds just further enhance that relaxation. Time where you felt anxious or depressed, allow yourself to have that moment come into your awareness. I want you to check in with that moment. See if there's a message. What did you need for yourself in that moment? What was missing there? Feeling alone, stressed, perhaps overwhelmed. You to imagine now that you're able to reach out and to hold that part of you, to embrace that part of you. Offering that part of you love, compassion, permission to heal. To get in touch with that feeling that you had earlier. And you're connected with those roots beneath you, allowing that energy and that life force to come straight through, up and out the top of your head, and to remind that part of you that you, and only you, created that moment. That anytime you need to do that, you have the ability to do so. And all you need to do is imagine that you have those roots beneath your feet. And perhaps any of those colors that came to you. Just allowing that to travel through your entire body. Offering this self-love, self-care, compassion, allowing yourself to be completely at peace, knowing that you have all the resources within you to manifest that peace and create joy and happiness in your life. Simply by using the resource of your breath. You could send this energy anywhere that you may need it. Perhaps there's a place triggers you where you feel more anxious, more stressed. You can send your breath and visualize that you're pulling that into those areas. And it'll immediately eliminate. Connecting with your breath. So I invite you to use an anchor. You can either put your hand on your chest, or you can put your hands together. Anything that you want to do, any kind of body, mind sensation that'll help you link to this mind-body connection anytime you need it moving forward. Just pay attention to whatever body position you choose. want you to set an internal clock for 30 seconds. When you get to that 30 seconds, you can go ahead and open your eyes, come back to the room, fully relaxed, fully refreshed. How was that for some of you? Some of you look like you struggled with that a little bit. Yeah. Do you guys want the lights on or do you like it like this? Sorry, me too. The other one was giving me a headache. Alright, so if you don't mind, I'm just going to ask and you can share whatever you want, but and for some reason I feel inclined to start over here, but I'm just curious as to what that was like for you and if you noticed anything throughout the meditation. What did you notice before? What did you notice after?
It was very calming. I had a lot of green. But I knew that every day. And there would be a lot of green. But yeah, I felt a sense of calm. So that's good.
Was there anything hard about that, being able to just sit with yourself and be mindful and like fully pay attention to your body?
It always is. Because I have 1,000 things going on. So. But I'm working.
It was really painful, like to go where the pain is, and when you were saying send love, just where you want. I was like, I need to send it to myself in this situation, and just really work on healing myself and seeing the situation for what it is. And that was what I did.
Were you able to at any point allow yourself
Yes.
to, okay.
Yeah, it was very healing. It was hard going through it, but it was very healing. So, yeah. You know me, I'm not afraid of going through it.
It's interesting because this side was the side that was like struggling the most, I noticed, versus this side.
Yeah.
So, yeah. And as I'm saying that out loud, I think that this is, for me, facing this way, this is left, which is feminine energy, which is parasympathetic, which we'll talk briefly about that. Those of you that have me already know a little bit about that, but so just let me note that, and then we'll talk more about that, because yeah, we'll note that. Okay.
So every time I meditate, like in the very beginning, I really struggle with thinking I deserved it. So that was hard, but then I did. I like talked myself into saying that I do. I've had past trauma, so like some of that came up. With the part where you said, like, go back and think about a time where you felt anxious, like I didn't expect that, and it just like hit me, but it felt very healing doing it. It was good. Like I do feel like refreshed after doing it.
Yeah.
And that was a spur of the moment. So like when I do my meditations, a lot of times I pick up on like what's needed, and so for some reason that came to me that I needed to do that to help them with the resource state, which is what we did, or an anchor, which when I do that in hypnotherapy, we'll do that too. So yeah, that message came to me that was needed. So.
Very helpful.
At the beginning, it was like kind of hard to breathe when I was like unaware of everything. But then after I like let go, I was able to go really deep into it.
thought, I have been tense because I didn't get real good news this spring. So I was able to relax enough and get rid of some of the tightness in my shoulder.
Are you comfortable sharing?
Um, the pain in my rib was another spot, and apparently there's one in my shoulder and two more on my hips. It's definitely spread far, a lot farther than I thought.
Did you want to tell them, or, I mean, you don't have to if you don't want to.
I have stage 4 thyroid cancer. And it was found out a year and a half ago through a bone biopsy. I went in for allergies and came out with cancer. And we've been going through so many tests, and it was finally, you know, I had said the last time I saw him, yes, we want to do this, and he didn't do anything until now. So I'm just waiting for them to call me back with the schedule for the radiation. And it'll probably be about a week before I get the meds sent. And the list of the side effects are just astronomical. But I'll get through them. I know I will.
So I think it's going to be really important for you to, not just with this, but, you know, even the other one that we had done together, like make sure you're listening to that to help kind of heal and release what needs to happen within the body as much as you can with your resources. And we'll keep working on that.
I knew I had this to come to that I knew was going to help me, so. Doesn't seem like it, but it has.
Anytime you can release is good.
Well, and the good thing about this is obviously the focus was on anxiety depression, so you already know anyone that's here is, you know, got some stuff going on, so. Including myself. I've been a wreck, so that's why as I do these too, I'm also doing it for myself, and so I'm not just channeling in, you know, what you guys need, but then I'm also channeling in what I need, and that helped me because I've been like going, you know, having a lot of stressors and stuff coming up. So, so that in regards to mindfulness, because I know I mentioned that for the workshop piece. Does everybody know what mindfulness means? Okay. So do you know what makes it difficult to not be mindful?
Letting one side overtake the other side.
Which side are you talking about?
The emotional taking over the logical.
Anyone else want to add to that? What makes it difficult to be mindful?
For me, like worrying about stuff I can't fix right now. Like right now we're in this workshop. That's all I can worry about. That's all I can do. But sometimes your mind is like, what's this and that, you know, I'm just worrying. Yeah.
Give yourself permission to take care of yourself. Let yourself be number one person.
I struggle with that a lot. Like, I feel very guilty when I take care of myself. It's one of the past 2 years I've been able to, like, do it, but I still have those thoughts. I overcome them. Like, I think mindfulness does help me, but I still struggle with that.
I've been a caretaker pretty much my whole life. I'm the oldest of 4 and the oldest daughter of an oldest daughter, so you know, it was ingrained. That was, you know, everyone else comes first. And it's very hard to say, I'm done with all of you. I'm doing this for me. And the guilt sets in. That just adds other things.
It's like hard to stay in the moment, not think about the future.
Are all of you familiar with the different states of the mind, like the 3 states, from a DBT perspective would be what some of you might be familiar with. So you've got your wise mind, which is in the middle, and then you've got rational or logic on one side, and then your emotion on the other. So when Kathy was talking about that, she meant where the emotions take over. For some people, they get stuck in the emotion, and that's what controls it. And then for others, they're too stuck in logic. So I would say for anxiety, more times it's the thoughts, right, that are kind of really controlling it, and then the depression is more the emotion. So I was talking a little bit about the parasympathetic, sympathetic, and basically our bodies are split in regards to the central nervous system. And so on the left side of the body, you have your parasympathetic, and then right side is your sympathetic. So when I was talking about this over here, about, it was interesting that it was the left side. So if I'm feeling really anxious or having a hard time, sitting still or focusing, odds are I'm in more sympathetic, and so look at it as I'm neglecting the left side of my body, which is why I thought that was interesting, because I'm like, okay, left side here, so what's missing with that left side? And then on the right side, it would be obviously the vice versa. So if I'm feeling really anxious, that's my sympathetic nervous system, that's extreme overload. So my body isn't at that point naturally balancing out. So it should be kind of crisscrossing throughout your center to help you balance that out. But most people, all the way from the moment that you were actually conceived, start learning how to cope based on simply just your nervous system. And so an example that I give is if you're, let's say you're in your mom smoked while you were in the womb, or maybe she was really stressed out, or maybe she was on a certain medication. So when you're actually in the womb, your only resource you have is going to be your nervous system, because you don't know anything else. So the body is naturally going to respond. So let's just say mom's really anxious. So now you're taking that on, so now your sympathetic nervous system is acting up. So now the left side of the body, or the parasympathetic, is starting to kind of dissipate, I guess the word would be. What's going to happen? So when things, let's say while you're in the womb, if things are becoming too much while you're in there, what do you think is going to happen to your body eventually?
It's going to break down.
Right, shuts down. So that's where I kind of think of it as, when you're filling up. So if it's the right side, which is that anxiety side, things start getting to the point where it's filling up so much, and then it's going to run out of room, and so now it's going to kick into the other side, and so then that's where the numbing out comes into play. And this also goes with addictions, and we're not really going to go too much into that, but some of you that I work with are aware of how I look at like the codependency cycle and how it relates to our different behavioral patterns. So it could be, I'll use the example of, okay, now when the baby's born, and now what do you think happens when the baby's feeling really stressed out? What would a baby do when it's stressed and needs something? Yeah. So again, that sympathetic nervous system, kind of having that, I call them temper tantrum. I still have temper tantrums. I had one yesterday. So that builds up, and then again, and then you're going to shut down. So this you've already created while you were in the womb this resource state of subconsciously, so you don't even think about it. Your body is already programmed now how to respond. And then there's also going to be thoughts that go along with that. So some of you that do the hypnotherapy know where we would check in to see, so in that example, like with the baby, let's just say baby's crying, mom's not coming, or dad's not coming, and so what might be a conclusion? How might that baby personalize that experience to mean something about herself or himself?
Don't love me.
Yeah. So I'm not loved, I'm not wanted, I'm not important. And so then based on that, you develop behaviors. And so these keep piling on, which then contribute to your either anxiety or depression. So if, the one example might be, well, if I'm not important, I'm not loved, then that temper tantrum as they get older becomes more and more and out of control, and because they don't care. They might have an I don't care attitude, versus the other extreme, which is more related to the depression, is okay, I'm just gonna be invisible. I'm gonna shut down, not be seen, not be heard. And so these patterns follow you, which then, when I work with some individuals that have, like out of a scale from 1 to 10, have a 10 with anxiety, the goal obviously, which through the hypnotherapy, is to be able to identify like where does this all go back to, and identifying those root beliefs that you have about yourself, and then the behaviors, and based on those behaviors is usually where you can see how that anxiety depression piece comes into play. But then you also get to do the release work. So what we did today in the meditation is just one of many examples of how you yourself can release that. So just by using your breath, you can go back in and correct the experience. So typically, like let's say you were in a normal workshop that didn't offer that meditation, how would you have dealt with if you were feeling, antsy or even numb? Like what would your response to that be? Anyone want to share?
I get chest pains.
Okay. And then when you get the chest pains, what do?
I try not to panic.
Okay.
Only because, chest pain can do so many things. But, yeah, I have to try and breathe through it, and sometimes it works, sometimes it doesn't.
Okay. And when it doesn't work, what usually happens?
I try not to,
Yeah.
but
Yeah.
it's my last resort.
Or were you going to share?
Well, you just remind me, like, I have a history of, like, if I'm somewhere and it happens, I just go to the bathroom stall, and I used to self-harm, to have a panic attack, and then come back and pretend it didn't happen. But I haven't done that in a long time, but that's what I did for a long time. Yeah.
So that's kind of an example of, so if I'm, and I know this isn't probably the same thing, but if I'm running out the room or kind of, leaving,
Yeah.
so that's the anxiety that kicks in, that sympathetic nervous system, and it's also a learned behavior, so I'm out of here, and then isolating, which would be the other extreme, which is now I'm kind of just numbing out, not being seen, not, just, so it's important to really start paying attention to, which again, when I do the meditations, that's why I like to have you guys kind of check in with your body, because that's part of mindfulness, is to just be in the moment, pay attention. I tell some of my clients about doing the body scans. So similar to, we start it from your feet, you could start from your head. I personally like doing the feet, although sometimes depending on the person and what I feel like they need, we might start with the head. But just going through each body part and just checking in and seeing like, okay, what am I feeling here? And then what we're going to learn then how the oils come into play with that. But your breath in itself, you can channel it into wherever you need to, and then add the oils on top of it. And then even add, like I use the colors as another way where you can really use that color, send it to where it needs to go. I try to match up, so like if I'm smelling, let's say if I have a migraine and I'm smelling the peppermint, I'll visualize that color green. So I'm like really intensifying it and sending it up into my head. Imagine that it's, pouring out. So those are just a couple of the ways that you can actually focus on releasing it from your body, and that's a resource that you have with you no matter where. The other one is, and some of you probably already know this, if you remember Lefty Loosey, the left side of your nostril will help you loosen up. So if you're feeling really, really anxious, block the right and just breathe through your left, and just sit there and take a couple deep breaths. And then the opposite. So if I'm feeling low energy, depressed, unmotivated, then I don't want to loosen up, so I'm going to block the left and just breathe through the right. And then again, once we start adding the oils, I'll even take whichever oil that I need, and as I'm blocking, let's say I need that energy, so I'm going to block the left and I'll put a citrusy smell here, and I'll just start breathing that in for a minute or two, and then that instantly gives me that energy that I need. My body's balanced back out. I even have in my car a water diffuser that plugs in. So I have, so actually that'll lead us into the next part. Does anyone have any questions with anything I said so far? No? Okay. So let's talk about with the oils. How do you use the oils? I'll let you just take one and pass. And some of you might already know this, but I just want to make sure we briefly cover it, because how many of you already use oils?
I do, but I don't really know. I don't know
Okay.
enough about it.
You know me.
Okay. Yeah, so I figured we'd go over this because I'm not sure who was going to be new to it and who wouldn't be. All right, so there's going to be 3 ways that you can use the oils. So the first one is going to be through your nose, so just smelling it in. They give some suggestions on here as to how you could do that. I didn't realize they put on here dryer sheets. I actually got this off of the doTERRA. doTERRA is my favorite out of all the oils. So they actually have a lot of resources. So if you wanted to go on either doTERRA or Young Living's website, those are usually the most effective and most educational ones that I feel. But this one specifically came off of doTERRA. So basically when you're using the diffuser, so there's different types of diffusers. So you've got your water-based diffuser, which is my personal favorite. And the way that that works is it's attaching itself to the water and then putting it into the air. And so it's actually just like with the meditation, how I told you guys to like use your breath and expand it. It's taking up more space within the air versus, you know, like if I were to take a water bottle right now and spray it right here, what do you think would happen?
Kind of running through the room.
Right, versus if I'm just doing this. And so when you see people in the summertime, sometimes that are, you know, they're spraying themselves and then you've got the breeze and it's like, ugh, it feels a lot better. That is a personal preference, I'm sure, but I know for me personally, I find that the water ones are more effective. They do have the electric ones or the battery ones where you can plug it in and then it's usually just a little pad that you put it on there. I feel like those are too strong, like it's got more of a chemical kind of smell to it, but again, that's my personal preference. And I don't feel like it's as effective as when I put it into the water. It also lasts longer when you do it in the water versus if you're using the little pads, because then it wears out pretty quickly. Like I'll sometimes give people it on a tissue, so obviously that tissue isn't going to last very long versus if you're putting it in with the water where it's going to last a lot longer. And actually, I'm happy that I had. I thought I had another sheet. That looked at like the benefits of like the differences, but I'm just gonna, you know, obviously tell you what they are then. So you use less oil when you're doing it with the water versus the other route.
My granddaughter.
What's that?
My granddaughter, she thinks you need 30 of everything.
Another thing that I do that would again be for smell, like I'll make my own little spray and then add whatever and I'll use it to spray and stuff. So people that have difficulties with sleeping, when you figure out, you know, the oils that are going to work best for you, spray it on your sheet. What I do is I tend to rub it on my hands and then I'll kind of just massage it into my pillow, into my bed, and so that way it's there. For some reason when I do that, I feel like that works better than doing the actual spray. I can't explain why. Maybe that's a mental thing, but or I do massage too, as long as I know the person doesn't have any sensitivities, I'll put it on the massage table in there. I'm trying to think if there's anything else I want to add. Does anyone else want to add anything to that for the aromatic with just smelling? No? Okay. So the next one would be the topical. And of course, this one you got to be careful with. So I obviously have a ton of different oils here. These are ones that I've personally used, and this one is a little newer for me. So actually a lot of these are even unopened, but I'd like to experiment and see what's best for my money. So with the topical piece, if you're new to oils, you want to make sure that you first put some kind of base. So whether it's a lotion, I use coconut or grapeseed oil, which I believe is what I have in the middle.
Grapeseed.
Yeah, because most people don't have allergies to that either, so that's usually, or the coconut oil. But there's a lot of different other oil bases that you can use. For people that don't want to do that, I usually just say use a lotion, a cheap lotion if you want, just to make sure that at first you're not having any kind of irritation or sensitivity to it. I've been using oils for a really long time, years and years and years, and I can honestly say that I only had one incident with a client that reacted, and in all honesty, I feel like it was more her anxiety, because just the thought of like seeing, and this was in a setting, a group setting, and I had actually less than this. I brought some of my oils in, and she knew we were going to be working on it, and she immediately started panicking. And so I think that what she was, the spots that she was getting was more of an anxiety reaction versus the oils, because she hadn't even touched the oils yet. So, nor had I even opened the bottle. So I'm pretty sure that it was more anxiety in that example. I know though personally, so if you have an allergy to something, obviously you're not going to want to. So some of the plant-based ones I have to be careful with, because I shouldn't say, like, which one is it here? I think it's the citronella. I know I have a reaction to, and there's one other one and I can't remember what it was. But I went through like extensive allergy testing, so I know. I also have asthma, so that's another common thing that I'll have from people. And obviously I'm not a doctor, so I'm going to put that out there. So it's a use at your own risk type thing, and talk with your doctor, but I'm just sharing my experiences and professional experiences as well. So you want to make sure that whatever it is that you're allergic to, you're not coming into contact with. And sometimes it's also going to be like trial and error, as you're going to see with a lot of these oils. What was I saying right before that? Just told me I was that train of thought. What was I saying? Oh my goodness.
Oh, the asthma.
Plant-based.
Well, so, okay, so, and that was probably the wrong word to use, because they're all plant-based. So what I meant was, like, if there's any specific allergy, so even some of the food, like the citrus ones, if you're allergic to oranges, obviously you're not going to want to use an orange essential oil. So I feel like that would be common sense, but I like to just throw that in there so that people are understanding. And then you may find that as you're trying some of them out, that you do have some kind of reaction to it, so then obviously you're not going to want to use it. As you become more advanced and use them more, like I know for me it takes a lot more, and I don't use any kind of base anymore. Like when I first started I did, but I don't put any oil base with it. I just put it straight onto me. And even in my diffusers and stuff, I notice, and I feel bad because sometimes when clients come in, they're like, oh my gosh, that's so strong. I need more oils for it to feel like it's working for me. So you'll probably notice that too as time goes on. All of this obviously is getting into the bloodstream, which is why it's pretty effective. Based on the different oils, which is what you're going to see on the list too. It's also, I like to compare it with the nervous system, so it's going to be helping you with your sympathetic and your parasympathetic nervous system, and that's one of the benefits that you're going to get. Some of these oils, they actually suggest for both depression, anxiety, and I'll explain that when we get to the list. There's sensitive areas, so for example, if you have a migraine, I know I talked about that like with headaches, and I'll use peppermint oil. Obviously, peppermint by your eyes is going to be pretty potent and painful. Again, because I've been doing it for so long, I already know that. I'll just close my eyes. I do just put it straight onto my forehead and massage it in, but then I don't open my eyes for a few minutes because it burns. So on here they give you a couple sensitive areas that you want to be careful of. So obviously, so your facial areas are going to be the eyes. They talk about inner ears, and again, I'm not a doctor, but and this will go this will go into the next part of like internal. There are oils that I use a lot of oils for, like I had issues with, my ear kept blocking, and so finally after, the doctors kept saying, oh, well, there's no infection going on, I ended up using some tea tree oil and put it on a Q-tip, and I just kept a couple times a day rubbing that in, and surprisingly, that's what helped. And I had that going on for a really long time. What was the other one? I don't ever obviously use it in my eyes. That I've never heard of anybody suggesting that, so I do not put it in your eyes. And then of course if you've got, so they talk about if you have broken or damaged skin, any kind of open sores, that's going to be up to you guys, but I do and I have based on the specific oils, because they do have, I prefer doing it before going to the doctor. Like and if I'm not sure what to do, I do my research and I'll find what it is and then I'll apply it. So I do, but for most of you, I would suggest obviously avoiding that for right now until you become more knowledgeable and have a conversation even with your doctor about it. And then the other one would be the internal. So a lot of people will say, don't ever, ingest, don't put it internally. I've internally put this in many spots of my body, so I'm just gonna say I've used it. But again, I am knowledgeable about like which oils and what works best, and that's something that I had to kind of play with. I find it to be effective. Now what you want to be careful of with the oils are, you want to make sure that they're therapeutic grade, and I've actually come across oils, and I didn't even think to bring those are at my other office, that claimed that they were therapeutic grade, and then I got it and they came from China, and I didn't know that when I ordered them, and of course I should have known because it was like one of those too good to be true deals, and it was horrible. Like it, just smelling it, you can smell the synthetics and the chemical based stuff that was in there, so obviously that was a waste of money, didn't use it. So what you're going to be looking for, and actually let me pass one just so you can see. Huh?
Bergamot.
Bergamot. I gotta see which brand. I've got bergamot in a couple. Okay, so this is Aracacia, which is one of my favorites. Not more than the doTERRA. And this you could actually buy at a grocery store and at the drug stores in the vitamin sections. So what you're going to look at, and I'll pass this so you can see, is where it says ingredients, and it'll tell you what's in here, and then the origin, because different oils come from, if it's a true really good therapeutic oil, it's going to come from where that actual plant is known for. So this says Italy. Some of them are synthetically made, like in an actual warehouse, so I try to avoid as much as I can those oils. So I'll let you pass this, and actually I want to show you, I thought I had one in here, just so that I can show you. Well, it won't have ingredients. So if you look at the bottle and it doesn't say ingredients on it, that's an automatic clue that you do not want that oil. A lot of them that don't have the ingredients are going to be chemical and synthetic based and fragrance based. So like a lot of the, I think Scentsy and what are the ones that like are big into like with the candles and all of that stuff, who came up with like these different oils. They're not pure. They're not therapeutic.
Bath and Body Works has them now. They're not pure.
Yeah, because that was another big one that when I worked at the hospital, people would be like, and I would have people bring in on the day that we did this to share what they had, and so people were bringing in Bath and Body stuff. So when I was teaching them that and showing them, like even their, I think it's like their sleep one or the anxiety one that they
It's like
had.
aromatherapy. It literally says like aromatherapy.
Yeah, and there's so much stuff added to it, so you always want to make sure that you're looking at the ingredients. If you're buying a blend, so let's pass the blend one just so you can see. So for doTERRA, which is my favorite, Alright, this one is Aromatouch. So what I like about doTERRA, and I'll pass to you just so you can see this, is they actually have on here, so on the blends, they don't suggest for some of them that you ingest it, and the way that you would know is they list the supplement facts. So I'll pass this just so you can see. The one that actually says blend, you'll look and you'll find, and I apologize, these are so tiny, and you'll read and you'll see the ingredients are all essential oils, there's not anything added, and then this wild orange one has the supplement facts on there. So the orange, that would let you know like, okay, I can ingest it. Now a lot of these other oils don't have it. Young Living does. So if you want, I'll pass that one. This is oregano, just so you can see that they too have the supplement facts on there. So that's really important to pay attention to, and that's usually how you know like which ones you can ingest. There's different ways to ingest it, so they have suggestions of you can actually buy your own vegetable caps and you can make your own pills. I know for some of my clients I've suggested for like pain, those different remedies that you can do for that. Same with like,
4 ounces of water.
what's that?
Tells you to ingest it, dilute a drop in 4 ounces of water.
Yeah, so like when I was recently sick, and what I was doing was, sounds gross, but I was actually taking bone broth, warming that up, and then I was mixing the oregano, lemon, there was one other one that might have been frankincense. So I was gargling with it and then swallowing, and it really opened up my chest and my nasal passages, and it helped a lot. So I did once, years ago, try, and then my son laughed at me, and I legitimately almost called 911 because I thought that it would be okay to just put it in like a medicine cup and put the drops in there and then do like just as if it was medicine, and it was so potent that I couldn't breathe and like my eyes started watering. It was so bad. So I learned the hard way. I've never tried myself the pills, but a lot of people are fans of that. And doTERRA actually sells ones already that come in, like they sell, one of them is On Guard for when you're sick in like an actual kind of, what do you call that, a cough drop form. And those are, you know, really good. They've got the, I think Elizabeth, you've had them, those little peppermint
Oh, yeah, I have them.
ball things that, yeah, I've never tried it myself, but I always see her pulling them out, and I'm like, I should try and get that.
Oh, see that? Oh, really? You just open it and put one in your hand and you pop it in your mouth and you eat it.
Right.
Pop it in the can.
I've seen those at like holistic fairs, and
You guys try them. Right?
and I love the doTERRA, they'll have the blends in the roller.
Yeah.
I
Oh, here, you can pass those, I have.
I had bought one, an allergy one for my nephew, because, you know, he's miserable. I said, tell him to keep this in his pocket. Well, my mom discovered his younger brother gets real stuffy at night, so she's like, puts it on his face while he's sleeping, and she's like, he stopped snoring. I said, that's why I bought you the diffuser, to use that, so.
I have the peppermint in there.
I have one called Happy Hormones, that smells good, but.
So the Intune is one that I usually recommend for any clients that have ADHD or attention issues. I use that one actually if I'm having a hard time focusing, just like rubbing on my forehead. But it works. I do find that it actually
Is
helps.
it real? Some of them are more oily than others.
Yeah, that one I feel like is a little more oily than some of the other ones. Oh, the other
Some
one,
feel like you put them on and nothing.
so I could pass these around too. These are Windmere, and so for, I only have here, I have a stress relief, aches and pain, and a lavender, so those are roll-ons. I think Windmere, which you can actually get at the mall out of Earthbound, I personally feel like they're very diluted. Like I don't feel like they're that strong, not as potent. And then I'll pass these around too. So we've got, just you can take a look at this one. This Plant Guru is actually a really good one. It's cheap. All of these here, these oils, I think there's 14 of them you can get off of Amazon for like 20 bucks. And I've ingested them personally and I had no issues. Depending on some of them, they're not, I feel like they might not be as strong when compared to some of the other ones, but again, kind of get what you pay for. So, the Lotus Touch is one for massage therapists. There's a Massage Warehouse website that you could get off of. I'm not a big fan of these. These I've never tried to ingest, but they've got some different ones that I'm trying out. The Now brand is common in the health food stores. A lot of my clients actually get this one probably because it is in a health food store, so they feel like it's more legit. But these are the newer ones that I'm not too familiar with, so I figured like, okay, I'm gonna play with these now. I like to, when I come across a new one. One of my other favorite ones is Nature's Truth. Here, I can pass that one if you want just to look at that one. That one also is common in most of the grocery stores and drugstores in the vitamin section. Those I also do personally ingest. And I have this one little one, because I like to mention this. This one I got from, it's a lavender, and I had gotten from, what's not that Bath and Beyond, or maybe it is. What's that one down at Ridge Park Square that's got bedding and they
Bed Bath and
okay, so they sell like the little mini battery operated diffusers in there, and then of course the water-based one. So I went in there once to get a diffuser, and I noticed that the one that this was in with was made, the actual diffuser was made by doTERRA. So then when I pulled this oil out, it came for free, and I'll let you pass this. I smelled it, and then I compared it to my doTERRA, and I swear they were almost, it had to be, maybe they like, I'm not sure.
doTERRA could have made it for that company.
It's
And
possible,
they're
so it's
really
a
going-
cheaper version, and I thought like, okay, because they had a variety of different ones, so I never went back to get any other ones, but,
They do that, they have like
okay.
a very high standard, so what do? Well, they're not dumping, obviously, right? That's probably their grade B.
Seconds.
Yeah.
And it could not even be a lower standard, that company may have contracted with doTERRA to
yeah, I don't know enough about that, so I just kind of was like, okay.
marketing.
So what I usually do is I'm always looking for deals. So when this, a lot of times this Nature's Truth that they have at the drugstores will go on sale 2 for $5, which is an amazing deal. So I'll try to get those when I can. And then the Aracacia, Giant Eagle tends to put them on sale a lot. And then Amazon and eBay. So this kit here, which I love because I also use this as a technique for massage, it comes with 8 oils, and it has your lavender and your peppermint, which are my 2 go-to for the depression anxiety pieces. I can get this whole kit, and you get one of the coconut oils in there for about 70, 80 bucks. And you really got to search for it because a lot of them are trying to sell them for like 120 bucks or more. So as soon as I find it around that $80 mark, I grab it because some of those bottles in itself are like 30 bucks a bottle. So you're really getting a good deal when you can find the kits. And you want to be careful too if you're buying them from like eBay and Amazon, because some people will trick you and they'll say like, oh, it's doTERRA, but then they break them down and they'll like sell you like little bottles of them. And then I actually just bought a kit from some guy and was pretty upset because when I got it, what it seemed like, and I don't have proof, but what seemed like had happened, and I thought it was pretty cheap. One of the bottles completely leaked out, so he did send me another one, but it looked like he was just saving all the bottles that he had. Maybe he was a distributor, I'm not sure. And then they were not doTERRA. Like I've been using it long enough where I know, like, so filling them, and then the caps and stuff were not the same, so like he was re-sealing them. So I was a little ticked off about that, but not much that I was able to do. So and that was my fault too. I didn't read the reviews or anything like that. That's usually what I do, but I was desperate because I was like, oh, and the one that I needed was the one that leaked out. So I was even more upset. Okay, so any questions with the methods of how you can apply it and what to do? Okay, so then the last piece that I'm going to give you guys, and actually, I don't know if you have a pen you might want to add, there's a couple of them that you can add on here too that's not gonna be on here. So if you wanna take one, if you need pens. John, can you go grab a couple pens?
Stop writing checks or stop making sure you have a pen in your keys.
Okay. Alright, so. Just throw it in the middle, not if anyone needs them. Okay. Everybody got one? So there's a couple I'm gonna have you add on here, and you can just write it on the bottom. So on the side for anxiety, you could also add basil and citronella and oregano. And then on the depression side, tangerine. I tried to, and I probably have more here than what's actually on the list. Hopefully they're all on here. So what you'll find, especially if you Google search things, that some of these, they say, okay, well, they're gonna work for both depression or anxiety, but what I caution, and I try to break it up to make it more clear, is if it's more of a citrusy smell base, then you're gonna wanna use that for depression. So I want you to, again, think about, so if I'm anxious, and then I'm using, let's say, a peppermint or a citrusy smell, what do you think might happen with that?
Volume could increase.
Right, so you don't want to be smelling something, and this is based on years and years of experience and seeing it even with my clients. I have one client, no matter how many times I tell her, every week she comes in, she has severe panic attacks, and she'll only use the peppermint. And she'll say, so I'll ask her, did the peppermint help? No. Well, why do you keep using it? So peppermint smells and citrus smells are good for waking you up and giving you energy. So you don't want to use that for anxiety because you want that to come down. And more of the earth tones are going to be what you're going to want to use for the anxiety. And, you know, for some people you may find it's possible, because some of the citrus ones they do list are good for anxiety, but I highly advise against that only because I've seen where that actually can make it worse. But you can play with them, and there's so many other ones out there. The other one that I didn't mention here, name brand wise, and I'll pass this, is Jade Bloom. So they're one that I probably within the past year started using, and they have their own site. And they've got different forms. Theirs, I feel like, for some reason, I go through much faster, so it's like I have to use more to get the same effect. They have any and every, they have oils on their site that I've never even heard of, from A to Z. I mean, they've got a pretty huge list of oils that you can get. So I would say they're a good resource as well, like if you wanted to look up their stuff and get some information. They're called Jade Bloom. All right. Any questions about those that are on the list?
I have a question.
Uh-huh.
So I have lavender in my house, and I didn't know, am I supposed to dilute it if I just spray it on my pillow? Or is it okay that I've been using it just like how I bought it? It's like, it was one of the now ones, it was just lavender.
So you have it in like a...
I put it in a spray bottle, yeah.
Oh, well, does it irritate you in any kind of way?
No, not at all.
Oh, yeah, no,
I
that's
didn't
fine.
know.
As long as
Okay.
it's okay for you. Like I said, I put it straight onto mine. Like I rub it
Okay.
straight on my pillows and lay on it, and it doesn't affect me in any kind of way. That's why I usually tell people though, when you're first starting off, you probably want to dilute it. And so the next thing I'm actually going to pass is talking about how to dilute. That looks more at the bottles, which is what we're going to make today, but that can give you some ideas. Again, when I look at that, I think I put probably close to 40, 50 drops, but you'll see they usually suggest about 12 to 15 drops, and then fill the rest with the grapeseed oil or whatever oil base you're going to use. But even when I make them for clients, I tend to put a little more in it, but that's just my own preference, and I need a lot for,
I make my husband one for, he has discoid lupus and it's itchy. And I have to make sure I put more of certain ones, because if he doesn't smell it, he doesn't think it works. He
Yeah.
needs the scent, or, I don't know.
well, and that's,
Yeah.
you know, I think,
Maybe it's just the color, I don't know.
I feel like a lot of people, there is that misconception, so even if you're not smelling it, including myself, there's times where I'm like, I'm not smelling it, you're still breathing it in, so you're still
Right.
getting the benefit. Or, you know, even if you're rubbing it on you, there's times where I'll do that, and I'm like, okay, not really smelling it, but it's still getting into the
Right.
bloodstream, so you're still getting the impact of it. And then, in regards to like the frequency of it, you can use them, I would say, you know, every hour or two if, as needed, and then, you know, sometimes I use it more than that. I might, if I'm doing it as like a rub-on, there's been times where like every like 15 minutes I just keep adding, you know, more and more. So again, that's something you'll have to figure out for yourself. Moderation obviously is going to be important, just like with anything else. So you don't want to be, you know, filling up a whole tub with just oils, which that would be pretty expensive if you did. But when I do a bathtub, I typically, depending on what I'm putting in there, I will use obviously a lot more. So what I like to use this kit, because this is actually a technique, Aromatouch technique that I do on people. So I'll put 10 of each of those drops into my bath water, and then it feels pretty good. So I'm getting the full effect as if it was, you know, being applied in a massage. So you can play with that too. And I'll have a diffuser going in the bathroom. So I've got both the diffuser and then the bathtub water going with the oils. And even in my office over here, I have both. I have a water-based one, and then I do have an electric one, but it's from doTERRA, and it's technically you're supposed to, you hook up, like you can actually hook up this whole bottle to it, and then it would diffuse. Well, I feel like it is a waste in my
I don't
opinion.
like those
So I
ones
have
either.
one, I fill it up mostly with water, and then I'll put my drops in, and that's how I do it. And obviously it's cost effective that way, and it's not as strong. The other, I feel like it's way too strong when you do it that way. So I always have like 2 different types, but my room over there is pretty big, so I like to use both of them. Okay, any questions?
Slightly unrelated, but still.
It's okay.
So, I don't know if you have experience with pregnant women. Like, my sister's pregnant, I was thinking about maybe making like something for her. Is that advised, or is that like a whole other thing?
Well, obviously I'm not a doctor, so I'm
Yeah,
gonna put that
right.
disclaimer out there, but yeah, I've used it with people that are pregnant, and you see on this dilution chart, like you can even use it on infants. I used to actually have mothers that would bring their babies in, and I teach them how to apply it and where based on what conditions were going on. So I would obviously have her check with the doctor first just to make sure. I have another client that recently found out she was pregnant, and she hasn't talked to the doctor, but she instantly said, I can't use them because I'm pregnant. And I said, talk to your doctor, you know, you need to really.
Even on doTERRA's site, it'll tell you, like, I'm pretty sure peppermint is safe and lavender, but there's some of the other ones that pregnant women need to stay away from.
Okay, so I just,
Yeah.
so I was just curious. Thanks.
Yeah, I don't like to, in regards to that, because that's more of like a medical thing.
Yeah.
I usually
Right.
tell people, like, talk to your doctor. I'm not a doctor.
Right.
I can say, yes, I've had, you know, pregnant women successfully use it without any complications or issues, but yeah, there are certain ones that can. Same with pets, that was another thing. So you gotta be careful with, I have found that dogs are pretty good for the most part. It's the cats. And like, I had a client, I think, that had like lizards and like all these other random things. So there are certain oils that can cause death in some animals. That I'm not 100% too knowledgeable about, so I usually tell people, like, you know, Google search and find out for sure. But I've yet to have anybody that came back and said, like, any of these ones that I have, that if I've given them, that there was any kind of issues with that.
Well, if you mix it with grapeseed oil, that would be dangerous, because
Right.
they can't have grapes.
Right, and the grapeseed oil can't give to the dogs. But they like coconut oil. They like olive oil.
Oh, yeah. But yeah, grapes, raisins, They cannot.
No, I know they couldn't have chocolate.
Oh, they can't have chocolate either, and there's, some people say no garlic and others say it's
Yeah, I
okay.
mean, every other home remedy flea thing has garlic in it.
Yeah.
and it's-
But they say no onions.
Oh, I've heard that one too. The other thing I'm gonna mention too, Amazon, and I think they have an updated one now, but they sell like these really cool, they have a mini version and then the big book, and I'll pass this around. Anything and everything that you can think of in regards to a condition, you look it up and it tells you what page to go to and what oils you might need. So that's something that if you wanted to purchase, I find that to be helpful. And I'll refer to them with clients a lot if they have something going on and I'm not sure. So that's a good book, and you can get it pretty cheap on Amazon. Okay. Any other questions? Was there anything that I didn't cover that you want to know before we get into doing your
No,
oils?
no.
Okay. All right. We're all good with the recording.
Okay,
Kathy Boyd's here. Great. Okay.
great job.